efforts to manage and control the existing situation. Second wave COVID is very aggressive and has not spared newborn, toddlers, and children. People are searching a lot about COVID info in children, and a lot of inquiries coming to us and our consultants. We are here to provide you updated, relevant, and reliable information. Today, we have Dr. Srinivas Jakka, who is a senior consultant in pediatrics, pulmonology, and allergy at Ankura Hospital for Women and Children, KPHB. He has completed his MD in pediatrics and further trained in pediatrics, pulmonology, and allergy from the prestigious Alder Hey Children's Hospital, Liverpool, UK. He has more than 15 years of experience. For the maximum benefit and utilization of time, we have gathered all questions at once from the parents and from the other consultants. And Dr. Srinivas Jakka is going to give updated relevant information to us. Further, if you have any question, you are welcome to comment in the comment box and we will try to answer. Sir, I welcome you to FB Live. Sir, the first question, which we got from the parents, many parents, they are seeking that can we distinguish COVID infection from other viral infections and common cold?
Yes, it's a very common question. Unfortunately, it is difficult not only for parents but also for doctors to distinguish COVID from other viral infections, whether it's a common cold, whether it's a flu or a dengue-like illness, especially in the initial stages. Hence, if we suspect COVID in any other child, it's important to get testing done to confirm the diagnosis, because in the initial stages, COVID can mimic other viral illnesses very closely.
Okay, sir. And other question, which is also very widely patients have and parents have asked, what are the common symptoms of COVID in children?
Okay, so to understand the symptoms of COVID, we need to understand a little bit about the disease as well. So what happens when we are exposed to the virus? The virus enters the body and it spreads. And when this phase is called viremia. And at this phase, you have general and non-specific symptoms like fever, body pains, headache, loss of appetite, etc. Children also can have respiratory symptoms like mild cold, cough, sore throat, and other symptoms. And some children can have intestinal symptoms like stomach pain, vomiting, and loose stools. Older children can complain of loss of taste and smell sensation as well. So these are the initial symptoms, which are usually mild, and a vast majority of children recover in a week or so. So we call it a mild disease when there is no breathlessness or when there is no oxygen requirement or any other complications. So, however, in some children, the infection spreads to the lungs, where it causes pneumonia or infection in the lungs. There you see children having fast breathing and low oxygen levels. So when you have borderline low oxygen levels, so somewhere between 90 to 94%, then you call it moderate disease. So in addition, these children have fever, they can have worsening of cough, they can have fast breathing, and they can have low oxygen levels. This is moderate disease. However, in a very small minority of children, again, I have to repeat, a small minority of children, your body immune system has an exaggerated response, and there's a lot of chemical mediators called cytokines which are released, and this is called a cytokine storm. And in this stage, you have severe symptoms. You can have symptoms like worsening of breathlessness, where the breathing is very fast. In addition, there is grunting sound. The child can have severe chest retractions. The oxygen levels can go less than 90%. The child may become very drowsy. There can be some seizures. There can be refusal of intake of food. Then further on, when the multiple systems are involved, the child can have, there can be shock where your blood pressure goes down very low. There can be clotting problems. There can be accumulation of fluid in the lungs, what we call acute respiratory distress syndrome. There can be failure of multiple organs in the body, what we call multi-organ dysfunction syndromes. So this is all severe to critical illness, which you can see in a very small minority of children. So we can classify illness as mild, moderate, severe and critical. However, it has to be mentioned that in a significant number of children, the disease is asymptomatic and mild. The severe disease is seen only in a small minority of children.
Yes, doctor. So you have just told us just what are the mild, moderate kind of symptoms which the parent can notice in their children. And sir, when should we test for COVID infection in children?
So there are two groups of children. One group is children who have symptoms, which we discussed before. So when the parents notice that the child has any symptoms of COVID, then they can get a test done. The other group of children are where they don't have any symptoms, but they are in contact with a COVID positive adult in the family. And so this is the second group of children who can have COVID test. And a third group is children who are admitted to hospital due to for various procedures and things like that. Your doctor might want to rule out COVID infection in your child. So these are broad indications for COVID testing.
And sir, in the market, we just hearing about different kind of diagnosis. They are rapid, RT-PCR. So according to you, what is the best test to confirm the diagnosis?
In the current scenario, the best tests are the molecular tests. In the molecular test, we use a technique called polymerase chain reaction or PCR, also called as RT-PCR. This test involves taking a swab from the nose or mouth, and then what they do in the lab, they try to multiply the genetic material of the virus to detectable levels. So the current available best test for COVID is a COVID RT-PCR from a nasal or oral swab. However, like any other test, it's not 100% foolproof. You can still have false negative tests. So if a child whom you strongly suspect as COVID has a negative RT-PCR, we should repeat the test again to confirm or rule out the diagnosis.
Okay, sir. And what is the role of rapid antigen test?
Okay, the rapid antigen tests are the next best available option. They test for viral proteins. The advantage of rapid tests are you get the results very quickly. However, the disadvantage is they're less accurate compared to the RT-PCR tests. So when you do a rapid antigen test, and if the test is positive, it confirms the diagnosis. You don't need another RT-PCR test. However, if the rapid antigen test is negative, you would still need to do an RT-PCR test to confirm or rule out the diagnosis.
And doctor, we often are hearing about the antibody testing. So what is the role of this antibody testing?
Antibody test is a blood test which looks for antibodies produced by your immune system in reaction to the viral infection. However, it may take several days or weeks for the antibodies to develop. Hence, in practical sense, it may not be useful for diagnosis of acute COVID infection or disease. Antibody test only tells us that the person had COVID infection sometime in the past. The only indication of doing antibody testing is in a condition called multisystem inflammatory syndrome or MISC in children, which is a COVID complication that can occur several weeks later. So we will come to that as well. That's one condition where we do antibody testing. So antibody testing is not useful for acute infection or those who are suffering acutely from the disease.
Right. And sir, in the society, there is a lot of panic is there, and often we are hearing from our friends, relatives, and other parents that can we do CT scan to diagnose COVID infection in children immediately? We will know what is the lungs are in how much lungs are involved or not involved. So, what do you think about that, sir?
Unfortunately, CT scan is being misused for the diagnosis of COVID infection. Particularly in the past when the RT-PCR test was not easily available. But we see that less nowadays. Parents must remember that CT scan carries the risk of radiation several times compared to normal chest X-ray. So we don't recommend CT scan as a diagnosis for COVID infection. CT scan should be done only on advice of your doctor, and that too only in children with severe COVID illness who are admitted in the hospital. Otherwise, in routine practice, CT scan should not be done for the diagnosis of COVID in children.
And doctor, can children also can have severe COVID diseases? And which group of children are at risk of severe illness?
Yes. As discussed earlier, fortunately, severe COVID disease is very uncommon in children. So if you look at all the children exposed to COVID, 60 to 70% have asymptomatic disease or they do not have any symptoms at all. Of those who have symptoms, 10 to 20% have disease severe enough to admit in the hospital. And another 1 to 2% have very severe disease that requires them to be admitted to the intensive care unit. So compared to adults, fortunately, severe disease is very uncommon in children. Then if you ask what groups of children are at high risk for severe disease, children with chronic diseases, it can be your chronic lung disease, it can be your chronic heart problems, your neurological problems, intestinal problems, your liver or kidney problems, diabetes, children on cancer or cancer medications, children who have low immunity or so-called immunodeficiency disorders, all of these children are at high risk for severe COVID illness.
Yes, doctor. And what is multi-system inflammatory syndrome, which we have often read in many newspaper and hearing about this thing?
Multisystem inflammatory syndrome, called MISC, is a reaction that occurs 4 to 6 weeks after the initial COVID infection. This happens because of the exaggerated response of your immune system. And because of this exaggerated response, several chemicals called cytokines are released, and then multiple organs in our body are affected. So to call it a multisystem inflammatory disease, there should be a fever, there should be involvement of multiple organs, and there should be some evidence that your child had COVID infection in the past. Either it can be COVID symptoms or it can be COVID antibody testing. So when you fulfill this criteria, then we can say that the child has multisystem inflammatory syndrome.
And doctor, if a child is suffering from high fever and the critical conditions, so but how parents will recognize if it is a MISC or not?
Okay. Apart from high fever, there are some symptoms and signs which parents can recognize to suspect a multisystem inflammatory syndrome. For example, your child might have a rash. There can be pain in the neck, or there can be swellings in the neck. There can be swelling of your lips and tongue. There can be swelling of your hands and feet. Your child may have breathing difficulties or breathlessness. If your neurological system is involved, child can become lethargic, drowsy. There can be seizures. If your intestines are involved, there can be severe tummy pain, vomiting, severe diarrhea. So when there is involvement of these multiple systems, 4 to 6 weeks after initial COVID infection, and if these symptoms are seen, we should always suspect a multisystem inflammatory syndrome. It's important to recognize that sometimes the initial COVID infection may not be diagnosed. So either because your child doesn't have any symptoms or there was no COVID testing done. Many times we have parents saying that 4 weeks ago my child was fine, but we had COVID illness in the family. But the child comes up with multisystem inflammatory syndrome and we do antibodies and the child has COVID antibodies positive. So what I'm trying to say is multisystem inflammatory syndrome can present even after a mild COVID illness which was asymptomatic or not diagnosed. So this condition can progress rapidly if not treated. So parents should remember the symptoms and seek medical opinion if they suspect this in your child.
And doctor, this MISC it is curable? Can it be treated?
Yes. Most these children with multisystem inflammatory syndrome, they're usually sick when they come to the hospital, and usually they're treated in intensive care setup. So we have doctors have different options to treat these patients, and basically there are medicines to reduce the inflammation. In other words, these are the medicines to control the exaggerated immune response. So doctors can use medicines like IV immunoglobulins, steroids, tocilizumab, etc., depending on the condition of the patient to control the exaggerated immune reaction. If needed, doctors may also need to use anticoagulants or blood thinners like aspirin, enoxaparin, etc., depending on the need of the child. To summarize, if multisystem inflammatory syndrome presents early, you can very well control the disease and cure it.
In this current pandemic, how should a parent can get advice regarding the care of their COVID positive child?
Yeah, sometimes it can be a challenge, but if what I would suggest is, if your child has mild illness or if your child is asymptomatic but COVID positive, I would suggest that parents take consult from their doctor by tele-consultation method. This would prevent spread of infection in the community and would also avoid unnecessary travel to you. However, if you suspect that your child has severe illness, then you have to take your child to a COVID center or a hospital that admits COVID positive children so that you can get the best possible care.
And doctor, if a child doesn't have any kind of symptom, then what kind of treatment are expected?
Okay, if children don't have any symptoms or asymptomatic children, they do not require any special medications. There are no medicines to prevent the progress of the infection. They do not require any blood tests, nor do they require any CT scans. Parents should watch for the symptoms, which we have already discussed. However, it is important that these children are isolated from elderly and other vulnerable members of the family, because we know that even these asymptomatic children can spread the infection to other family members.
And doctor, what is happening due to multiple reason, like due to seasonal change, due to any other bacterial or viral infection, the child may get sick. But in what condition parents get worried enough to consult a doctor?
Right. So as we already discussed, the signs of moderate and severe disease. I would like to summarize once again what we call the signs or red flag signs for a sick child. So like any other illness, if your child has these red flag signs, so your child has any breathing difficulties, child is breathing fast, child is grunting, child has chest retractions, oxygen levels are low, that's involving of respiratory system. Similarly, if your child has severe stomach pain, severe vomiting or diarrhea, if your child is drowsy, not feeding well, not taking solids or liquids, and as a result, the child is dehydrated and urine output comes down, that's another indication. So, or if your child has any seizures, or if you feel that your child is drowsy, your hands or feet are cold and clammy. So these are all the warning signs which should prompt a parent to take your child to a hospital.
And sir, if as you mentioned that there could be mild cases also, and mostly it is mild cases. So how parents can manage mild cases at home?
So a mild case of COVID is one where there is no breathlessness and the normal oxygen levels, but mild symptoms like fever, headache, body pains, a mild cold and cough. These children can be managed by like any other viral infection. Make sure that the child has enough rest. Make sure that your child has plenty of fluids. And please make sure that your child is not dehydrated by monitoring the urine output. Your child should be passing urine 4 to 5 times in 24 hours period. If your child monitor the temperature, and if you can give you can give paracetamol depending on the weight of your child and advice of your doctor. If your child has any respiratory symptoms, you can monitor the oxygen saturation at home. Make sure that when you check the oxygen temperature saturations, your hands and feet of your child are warm and make sure that you're interpreting a good trace. So this is very important. And if, if a mild case does not require any medications, does not require any blood test or any CT scan. I would like to emphasize that again.
And sir, what is like in this panic situation in news, due to news also, media also from everywhere, people are hearing about the different medicine. Even in the WhatsApp also, I'm getting that use this medicine, that medicine. Like, so what is your opinion? What is the role of medicine like azithromycin, doxycycline, ivermectin with the veterinary medicine which was used, which people were using for the veterinary use also, but people are now hoarding these medicines. So, what is your opinion, sir?
Uh, there are several studies done on these medicines which we can use for home treatment or mild cases. And studies have shown that none of these drugs, including azithromycin, hydroxychloroquine, ivermectin, doxycycline, and favipiravir, have any benefit in home management of COVID positive patients. So sometimes people also use a combination of these drugs, which apart from not being beneficial, they can cause side effects as well. They can cause nausea, vomiting, they can affect the intake of food. So I would request parents not to use these medicines which do not have any value in the management of mild cases at home. Of course, as parents, it is difficult to accept that there is no treatment for your child. But remember, in majority of children, the disease is mild and they do not require any treatment. And parents should not, rather than rely on information on social media, I would request parents to get information from reliable websites. We have reliable websites like ICMR or Indian Council of Medical Research. We have All India Institute of Medical Sciences website. We have World Health Organization or WHO website. Then we have Center for Disease Control or CDC. Then we also have Indian Academy of Pediatrics when it comes to children. So parents should seek information from these websites to get authentic information.
And sir, unfortunately, if someone's child is severely, it will come under the severe COVID cases. In that case, how it is treated? Any specific hospitals are also there to treat that?
Yes, if the children fall into moderate and severe category, it's advisable that the children are treated in hospital. Of course, there are several hospitals in the city. Yankura also has some hospital branches where we're treating children and adults who are COVID positive. So once they're admitted in hospital, they're admitted either in the wards or intensive care units, depending on the severity of the condition, the age of the child, comorbidities, and other complications. The children or adults, whoever, then they can be given oxygen if the oxygen levels are low. If they require more than oxygen support, then they can be given other respiratory support, which can be in the form of HFNC, which is high flow oxygen through nasal cannula. It can be CPAP, which is continuous positive airway pressure. There can be non-invasive ventilation. There can be invasive ventilation. So depending on the severity of the illness, the doctor will decide what sort of respiratory support is best suited for that condition. Then, of course, fluids, management of complications like low blood pressure, shock, treatment of any complications like clotting, all of this come into consideration. There are also some medicines available for management of moderate and severe COVID patients. And these medicines can be broadly classified into anti-inflammatory drugs, antiviral drugs, and anticoagulants. So let us discuss these drugs. Let's first discuss drugs with antiviral action. The drugs with antiviral action, or which are supposed to inhibit the multiplication of the viruses, are remdesivir and plasma therapy. Okay, so if you look at remdesivir, It is an antiviral drug that prevents the multiplication of the virus. The FDA has approved it for children above 12 years and above 40 kgs. It's indicated in people who require oxygen or any other respiratory support. It should be, before we give remdesivir, we need to make sure that the liver and kidneys are working normally. They're not grossly abnormal. Then comes plasma therapy. Plasma is the liquid portion of blood after removing the various cell components. Once a patient recovers from COVID, the plasma is supposed to contain antibodies or chemicals made by immune system against the virus. The evidence for plasma is mixed, with some studies saying it's useful, whereas the other studies saying it's not of much use. However, if indicated, it has to be given in people with moderate disease and in early of illness. It's not useful for sick patients or given late in the illness. So both these drugs with antiviral properties, remdesivir and plasma, are useful if they're given early in the illness, say less than 10 days, and also on moderate disease. They have limited use in people with severe disease.
And sir, many videos were floated regarding the use of steroid in COVID infection. That after 5 days, if your fever is not subsiding, you can take the prednisolone or other kind of named branded name were there.
So the next group of drugs is anti-inflammatory drugs. These anti-inflammatory drugs, the steroids. The steroids act by controlling or suppressing the immune reaction to the COVID infection. They can be taken through an injection or they can be given through the mouth. There is a good evidence that steroids are useful when you are given in moderate to severe disease. So people who are requiring oxygen or requiring ventilatory or respiratory support, they're very useful. However, they are not of much use in people who are treated at home or mild disease. In fact, they can be harmful than useful, particularly if you give steroids early in the course of the disease. We will be interfering with our immune system in its fight against the virus. So steroids should be given only in sick patients requiring oxygen or respiratory support in the hospital. This is as far as children are concerned.
And sir, many molecules are coming from different parents are talking about different molecules. So one molecule is that tocilizumab. What is that molecule and what is the role in this COVID?
Yeah, tocilizumab is a medicine that inhibits interleukin-6. Interleukin-6 is a chemical that has an important role in our body's exaggerated immune response to the viral infection. By acting or inhibiting the action of interleukin-6, the tocilizumab controls the cytokine storm and all the ill effects that could arise due to that. And studies have shown that it has some role in hospitalized patients with a severe disease. So that's the role of tocilizumab.
And sir, many parents have asked that how does the infection spread to children?
Well, the infection can be spread to children from other children or adults. So when an infected person coughs, sneezes, or talks, the virus is released to respiratory droplets. So these respiratory droplets, when they're released into the air, there can be person-to-person contact when another person inhales these droplets into your airways and lungs. The other mechanism is these respiratory droplets fall into the surroundings, and when an adult or child touches these surroundings contaminated with these droplets and touches his eyes, nose, or mouth, they'll be transmitting the virus as well.
And when can the infected person spread the infection to others?
The infected person can spread infection to others 2 days before to up to 8 days after the onset of symptoms.
Okay.
This is the infective period.
So that is why I think 2 days before, that is why people don't know and they just infect other people.
So you have parents saying that after start, as my child have isolated my child away from me 2-3 days after the start of my infection, but still there is a chance that your child could get infected.
Okay. And when symptoms start developing after the exposure of COVID-19?
Yeah. So the time period between the exposure to the infection and the development of symptoms is called the incubation period. Now, in COVID, there is a incubation period ranges from 2 days to 14 days with a mean incubation period of 5 to 6 days.
And then how we can prevent our children from prevent COVID infection in our children?
Yeah. So it's the general measures what are being advocated to the public these days. Your social distancing, use of masks, use of sanitization, and in case of children, in addition, children should stay away from adults as far as possible who are COVID positive, and they should avoid unnecessary travel or public gatherings or social meetings, etc. So, and uh, these are the general measures children should be taking as well as adults as well.
And doctor, when we are talking about the mask, so from what age can children wear mask?
There are different recommendations for the age at which children can wear masks. The World Health Organization says masks can be worn from 5 years onwards. The Indian Academy of Pediatrics recommends that masks can be worn from 2 years of age onwards. The advice for children not wearing mask below 2 years is security reasons. So 2 years and above, children can wear mask, but parents should monitor them to make sure that they're breathing well, and then their breathing is not compromised.
Now, doctor, 1 year passed, but still we are focusing on wearing the mask. Can you again tell us once more that what are the measures to be taken when wearing the mask?
Yes. Like adults, children should follow certain precautions when using the mask. The mask should cover the nose, mouth, and chin. Children should avoid touching the outer surface of the mask. And whenever they handle their mask, whether they should wash their hands with a soap or sanitizer. Their parents should make sure that the child is breathing comfortably when they're wearing a mask, and avoid mask with walls. So these are some of the measures. And when the masks, parents should also ensure that the masks are hygienically disposed of after use. So these are the general measures which should be taken when using masks in children.
And doctor, what precaution a family should take if there are COVID positive adults in the family and children are also here and they're roaming in the small, in nuclear family?
Yes. So if adults are positive and children are negative, they can be taken care of by other members of the family in case of older children. However, in case of newborn babies or infants, and it may not be possible, particularly if mother is the only person available to take care of the child. So if mother is COVID positive and it is a very small infant, then mother can take care of the child provided she wears a good mask and takes all the necessary precautions.
And doctor, of course, it is very unfortunate, but how to take care if child is positive in the family, but adults are negative, then how to manage that thing?
So if child is positive and if adults are negative, for example, the parents are negative, so they can take care of the child while taking all the necessary precautions like masks and sanitization. However, it's important that uh, the adults or elderly in the family and people with comorbidities are isolated from the children. So there are two ways. One is either you can isolate the child. Sometimes it's difficult to isolate children, particularly toddlers who are very active. In that case, we can isolate the elderly who are at high risk so that children can have more freedom of movement. So summarizing, if children are positive, Adults who are low risk can take care of them while following necessary precautions, whereas elderly and those at high risk have to be separated from children in one way or the other.
And doctor, if a COVID positive mother is there who is breastfeeding her baby, so still she can breastfeed her baby?
Yes, absolutely. We all know the benefits of breastfeeding to the mother as well as the infant. And uh, there is very little evidence of spread through the breast milk. So, given the benefits of breast milk versus the small risk of transmission, the World Health Organization as well as several other organizations recommend continuation of breastfeeding in a COVID positive. However, mother has to take the necessary precautions whenever she feeds and handles the baby so that the risk of transmission is minimized.
So, doctor, can you tell us what precaution a COVID positive mother should take while breastfeeding her child?
Yes, as discussed earlier, she should be wearing a proper medical mask, and whenever she feeds or handles the baby, and she should be sanitizing her hand as well whenever she handles the baby. And so these are the measures mother can take to prevent the spread of infection to the infant.
And sir, sometimes what happened, mother might be severely ill and moderately ill, where she might be unable to breastfeed during COVID illness. So when can they restart the feeding again?
So once the mother recovers from the illness, when she's come back home from the hospital, she can restart the breastfeeding whenever she feels ready. And there is no evidence to suggest that breastfeeding will influence the course of mother's COVID illness.
And how should a COVID positive child be isolated?
Well, COVID positive child, as we already discussed, should be isolated from other high risk members of the family. And the Indian Council of Medical Research recommends that the isolation should be for a period of 10 days, out of which the last 3 days should not be fever. There should not be any fever for the last 3 days. So the isolation period recommended is for 10 days. A lot of people are repeating the COVID test and with a view that it should be negative before the child comes out of isolation. The ICMR as well as World Health Organization recommends that a repeat COVID test or a negative test is not required to come out of isolation. Some studies have shown that a person affected with COVID can be RT-PCR positive for even up to 3 months of illness. Okay, here the virus isolated by this cannot transmit the infection. Okay, so a 10 to 14 days is a reasonable period of isolation. Only thing is to ensure that before the child or adult comes out of isolation, they do not have any symptoms or fever for at least 3 days. Once they do not have any symptoms or fever for at least 3 days, and once 10 days is completed, then they can come out of isolation. So isolation is slightly different from quarantine. Quarantine is basically separating a person who had contact with a COVID positive individual. And here, because the incubation period can last up to 14 days, the total period of quarantine is 14 days. Okay, so the total recommended duration of isolation is 10 days.
Okay.
So the problem with doing a repeat COVID test is, I have seen people who are doing repeat COVID test second time, third time until it becomes negative. The problems are, one is it causes undue anxiety. Other problem is it puts a lot of strain on the already stretched lab resources in our country.
Right, sir. And sir, now we are talking that we are into second COVID wave. So what is the difference between first wave and second wave?
Well, recently ICMR has done a study comparing patients admitted during the first phase and second phase, and they have come out with some interesting facts. One, as we all know, The rate of spread of infection during the second wave is definitely much more compared to the first wave. So we see that once an individual is affected, that infection is spreading rapidly to family members and other contacts. So obviously the number of people infected is more in the second wave. However, as per the ICMR study, the number of people dying because of COVID or requiring ventilation is pretty much the same in the second wave when compared with the first wave. Okay. As far as the symptoms are concerned, a slightly more percentage of people in the second wave have breathlessness as a symptom. And hence, we also see more oxygen requirement during the second wave. If you look at the age groups, young people under 20 are having slightly higher proportion, not very much, a slightly high proportion in the second wave compared to the first wave. And like the first wave, people over 60 are at high risk of severe disease and mortality due to COVID. However, I should say that these studies are done on small numbers, so we probably need studies on larger number of people before we can get a clear picture. So to summarize, as per the ICMR study, although the more number of people are getting infected in the second wave, the severity of the disease is pretty much same compared to the first wave.
And doctor, there is a concern among the parents that if someone's child is COVID positive and his or her immunization schedule is due, so when they can give the routine immunization in a COVID positive child?
Okay. So firstly, it's very important that your child continues their immunization schedule even during this pandemic, because COVID is only one of the infections, and we know that there are many other childhood infections that can cause severe disease in your children. So once your child recovers from the COVID illness, and once we give 2 weeks time, so after 2 weeks after recovery from the COVID infection, your child can have the normal immunizations.
And doctor, if a child is COVID positive, but if he has certain other diseases like asthma, so so can they continue the long-term medication for their child?
Yes, definitely. Children who have chronic diseases like asthma, diabetes, or epilepsy or seizures, or other heart condition, etc., they should continue the medicines which they have been using for a long time. This is true particularly for children who do not have symptoms or who have mild disease. However, if your child is very sick and has to be admitted to the hospital, you should inform this condition and the medications used to your doctor treating your child so that they can give an appropriate alternative or replacement to that medication.
And sir, can antibiotics prevent or treat COVID-19?
Okay, this is a very important question. Antibiotics are antibacterial drugs. They're useful only for bacterial infections. And we know that COVID is a viral infection. So antibiotics have no role either in preventing or treating COVID infection in children or even adults for that matter. However, in some uncommon case where you are admitted in the intensive care unit and you're very, very sick, in these people, there is a risk of secondary bacterial infection. And in this case, a doctor might want to cover with antibiotics for secondary bacterial infection.
Sir, someone has asked that can hydroxychloroquine help prevent or treat COVID-19?
I mean, several studies have shown that hydroxychloroquine has no role either in preventing or treating COVID infections. So even the World Health Organization has come with a clear statement that hydroxychloroquine has no benefit in the treatment of COVID, either in adults or children.
And sir, people are hoarding vitamins and mineral supplement. So what do you think? Can vitamin and mineral supplement help in COVID-19?
Micronutrients like zinc, vitamin D, and vitamin C, they have an important role in functioning of your immune system and general well-being. However, there is no benefit or there's no evidence for a direct benefit in preventing or treating COVID infection.
And doctor, should people wear mask while exercising, running?
Well, using mask during exercise is generally not recommended because it can affect your breathing, and sweating during exercise also can block your mask, making it difficult to breathe, and that can also cause infection. So when people are doing exercise, it is better to maintain physical distance of at least 1 meter to prevent the spread of infection rather than wear a mask.
And what is the likelihood of shoes spreading COVID-19?
Yes, this is particularly parents are worried when they have infants or toddlers who crawl on the floor. So there is no evidence that these can spread COVID infection per se, but parents, when they have kids or toddlers who crawl on the floor, they can leave their shoes at the entrance of the house so that they don't carry the dirt into the house and children get exposed to the dirt.
Yes, sir. Because what happens that shoes is very what to say? Because in India we have a tendency. Many people have a tendency to spit here and there.
Yes,
So
yes.
that could be the reason that the parents are worrying about that.
Yeah.
And can swimming also transmit the COVID-19 virus?
There is no evidence to say that virus is spread through the water during swimming, but like any other outdoor activity, it can be spread through people who are close together, either during swimming or outside the swimming pool. So people who go for swimming should maintain that physical distance during swimming and after swimming as well to avoid the spread of infection.
And sir, in offices, in closed spaces, in other places, people are using medical masks for 8 hours, 6 hours continuously. And even for certain children, they have to wear mask in, the airplane. So in that case, does the prolonged use of medical mask cause any problems?
Definitely not. I mean, wearing masks for a prolonged period, particularly the medical mask, can be uncomfortable, no doubt, but there's no evidence that that can cause low oxygen levels or it can cause carbon dioxide retention in your body. So, when needed, people can safely wear masks for long periods of time. Just have to make sure that they're worn comfortably, they cover the nose, mouth, and chin, and they're able to breathe comfortably using that mask.
And sir, in our daily, the diet, shall we add any specific food to protect COVID-19 among children?
Uh, there is no evidence that taking any particular food will prevent or cure COVID infection. A healthy, balanced diet, making sure that we get all the components like carbohydrates, protein, fat, vitamins, and minerals, along with adequate exercise and sleep, is very important for general well-being as well as functioning of the immune system. So there is normal, healthy living, healthy diet, and exercise is all that's needed to make sure that the immune system is functioning optimally. And more important than that is a positive frame of mind. A lot of stress and anxiety can affect your general well-being and immune system, and that can actually make us more prone for all sorts of infections. So a positive frame of mind is one of the most important things to prevent infections and also stay healthy.
Sir, in this season, we can find a lot of mosquitoes, lot of house flies. So virus is transmitted through house flies or mosquitoes as well?
To date, there is no evidence that the virus is spread through mosquitoes or houseflies. However, in this, where there are a lot of mosquitoes, whenever a child or adult has fever, apart from COVID, we need to also think about malaria, dengue, and other infections as well, which can closely mimic COVID. But answering your question, there is no evidence that they can spread the COVID virus as such.
Okay. And doctor, to prevent our, children, we go to take the extreme step to save them, and we just take many different measures. So what measures, in your opinion, are unlikely to help in prevention of infection?
Well, there are several things where myths and several things which we use which have no role. For example, using disinfectants or bleach to the body parts, apart from not being of any use, they can irritate your skin and eyes, and they can be harmful. And we need to make sure that bleach and other stuff are kept away from the reach of children. That's one thing. And exposure to too much of sunlight, exposure to hand dryers, ultraviolet radiations, none of these have any evidence to protect or prevent COVID infection.
Sir, all the questions which were widely asked by the parents. So you have answered all the questions, sir. But sir, I will request if you can say 2, 3 words to the parents, how they can stay fit in their mind.
Okay, so few things. There is no doubt that
Coming to us.
the second wave, the infection spread is more compared to the first wave. But please remember that the severe disease is still very uncommon in children. So if your child turns out to be COVID positive, don't panic. Take the advice of your doctors. Look for reliable websites to get information. Stay positive. Take all the necessary precautions. And I'm sure that mankind has faced many pandemics in the past. And I'm sure we can tide over this crisis as well.
Thank you, sir. Thank you for your valuable time and answering all the questions. So that all time what we do, that being a parent, we search on website, and they are most of the time they are false information due to lack of the knowledge, So thank you very much, sir.
I will share some reliable websites on the Facebook as well, where parents can look into that and get authentic source of information.
Okay, sir. Thank you, sir. And sir, that Ankura Hospital has also started the COVID ward, and especially for children, we have at Banjara Hills and LB Nagar. We are admitting the cases, sir.
We are having 3 branches at Ankura, at Banjara Hills, at LB Nagar, as well as IDPL, where we are taking adults and children who are COVID positive. Okay. If you suspect if a child is COVID positive and sick, you can take your child to one of these branches to get optimal care.
Thank you, sir. Thank you, viewers, for tuning with us on the Facebook Live. Thank you very much. If you have any question, you can just type in the comment box. Our doctor will try to answer that question as soon as possible.
Thank you.
So stay healthy, stay safe, mask on. Thank you.